This is the first anatomy lesson for the ankle and foot. This time I'm going to have both basic anatomy and anatomy for running applied into the one video because on Monday, the day before, we were finishing up the toolkit. So a little bit about the structure. It's not going to be assessment based. I'm not going to be annoying and quiz you. All I'm trying to do is give you a nice, concise understanding of each joint as we work up week by week. You have your exercises and we've done the assessment. Now I'm just going to help you all understand it a little bit more. And you can ask for more detail if you would like more detail. Every Friday we'll be doing a recap of the week, so if you want me to cover anything in more depth, I certainly can do. So as far as the anatomy of the ankle and foot goes, I just want you to remember a few bones, a few muscles and the movements associated with those bones and muscles. So first of all, we have the shin or the tibia bone. You'll hear that there. Everyone knows about the shin. The shin is called the tibia. We also have the fibula, which comes down laterally just to the outside of the tibia. Now, some people break the tibia, some people break the fibula, some people are very unlucky, might break both. You might hear of a tib-fib fracture, a tib-fib break. The tibia and the fibula form the lower limb, which comes down to the ankle. Now, as far as the ankle bones and the foot bones go, that's it. I just want you to think of the ankle and foot bones. But they are, between the shin and the ankle, there are two joints that I want you to remember, the talocrural joint and the subtalar joint. So the talocrural joint, this is the movements that it does, up and down, like so, at the ankle. We call this plantar flexion and dorsiflexion. Plantar flexion down the way, dorsiflexion up the way. The subtalar joint does this outward movement and inward movement. Outwards and inwards, or eversion and inversion. Again, eversion and inversion. So we have the tibia, the fibula, the ankle, foot and bones, and the two joints, the talocrural, up and down, and the subtalar, out the way and in the way, like so. Plantar flexion, dorsiflexion, eversion and inversion. So for the muscles of the ankle and foot, we're going to start right here. Everyone knows the calf. The calf is comprised of two muscles, the gastrocnemius muscle there, which is bulkier and makes up the shape of the calf, and we have a deeper muscle, the soleus. Again, the soleus sits deeper to the gastrocnemius muscle. Both comprise the calf muscle, and both, when they contract, do plantar flexion of the ankle, like so. So they bring the foot down the way, like so. Now at the front of the shin, we have the tibialis anterior, which is the front of the shin. That's the shin. That's the muscle, the softer part there. The tibialis anterior, along with a few other muscles, will do this action here, which is dorsiflexion. So to summarize again, the gastrocnemius and soleus, which make the calf plantar flex, and the tibialis anterior, along with a few other muscles that we don't really need to know the names of, they will dorsiflex the ankle joint like so. Now for the outside and inside of the ankle and foot area, we have the peroneal muscles which come down the outside here. They will evert the foot and pull that out the way. And then we have the tibialis posterior down here, which inverts the foot like so. So we have the calf, which plantar flexes. We have the tibialis anterior, which dorsiflexes. We have the peroneal muscles on the outside that everts, and we have the tibialis posterior muscle that invert. So again, plantar flexion, dorsiflexion, eversion, and inversion.
So here is the tibia in green, and here is the fibula now in green. Let's just have a quick look at the bones of the ankle and foot. And now I'm going to highlight the surface of that hinge joint, which does the plantar flexion down the way and the dorsiflexion up the way. And now the surface of the subtalar joint, which does the outwards and inwards movement, the eversion and inversion movements of the ankle. And we'll come back to here, and I'm going to add some muscles to look at. So the first one we're going to look at is the tibialis anterior muscle. That pulls the foot up the way to dorsiflex. Here is the lateral and medial head of the gastrocnemius, that bigger calf muscle, and then there's the Achilles tendon, just for good measure. And that is the soleus muscle. You can see that that is deeper to the gastrocnemius, like I was saying in the video. The peroneal muscle, also known as the fibularis longus, that is highlighted there. And then I'm going to have to just cut away a few muscles here to isolate the tibialis posterior. And you'll see that runs deeply down the inside and then wraps around the inside of the ankle there.
So I'm going to show you the running anatomy on the treatment table here because it's the best and brightest space in the clinic to use, but you'll see that I'm challenging my own stability a little bit as I'm doing so. Keep your eye on the foot that touches this midfoot section of the bed because that's what I'm going to be talking about as I do it. So typically when we run, we will strike the ground in a dorsiflex position of the ankle, and we will then roll onto the midfoot as we run, and then onto the toes, and then the ankle finishes in a plantar flexed position. Now to go over that again, we'll strike the ground in a dorsiflex position like so, sometimes a little bit more neutral, and then we'll roll onto the midfoot and then onto the toes to then plantar flex and then toe off. So plantar flexion and toe off. For some runners, or if you're running uphill, you might land a little bit more midfoot, so more neutral, and then toe off, or you might even land more forefoot for certain runs like trail runners. That's absolutely fine. I'm just showing you the full range from the heel to the toe for the purpose of the running anatomy. And I'm also not making any changes or recommendations to your own running technique from this program. I'm just getting your body better for your running technique and showing you that it's more about what's on the inside and how the muscles work rather than how it looks on the outside. Now, one more important factor that I want to mention is the tibialis posterior muscle on the inside here and the peroneal muscle down here. They both stabilize the ankle. So in your single leg squats or in your single leg balances, if you had a little bit of ankle movement or knee movement, it's likely that your ankles are slightly weaker in the tibialis posterior and peroneal muscles there. What that means for running is when you're running, you're relying more on the momentum and the motion going forward, that linear motion to keep you upright, and these muscles aren't stabilizing the ankle to keep you upright. So 3 to 4 times our body weight when we're running through. If we've not got good single leg balance and single leg squats, when we apply even more force, we're relying more on the force and the momentum to keep us upright, and we'll actually be straining a lot of other muscles. So strengthening these muscles here will be really important, and single leg squats as an exercise and the other balance exercises within your programs are going to focus on just that. So that was the basic anatomy and functional anatomy of the foot and ankle for running. Now you'll notice at the end there I mentioned ankle stability. Ankle stability is important because it stops other muscles getting tight and it helps prevent injuries. Now if you had any of the dysfunctions within the single leg balances or the single leg squats, then improving those through the exercises are going to be super beneficial. If the ankle stability muscles aren't working down the outside here, it can cause the calves to get tighter, it can cause the shin muscle at the front of the tibialis anterior to get tighter too. We can get tight and sore calves, Achilles problems, we can get shin splints at the front, but also we can get predisposition to ankle sprains if the ankle's not stable enough as well. So ankle stability, absolutely fundamental. So those single leg balances and single leg squats, get working on them through the exercises. Any questions at all, just let me know in the comments. And if you want me to cover anything in more detail again on Fridays, I can do that at any point as well. So just let me know in the comments.